And then we're gonna slowly roll back. We're gonna clear up right in here. Oh! Wow.
Oh!
Wow.
I felt that in my stomach.
Yeah. Just soften the shoulder. There we go.
Oh my God.
Yeah. Beautiful.
Wow. Yeah, you were right. I felt it in my upper back, like in my neck.
What did it feel like?
Like a big stretch.
Yeah. All right, so I got Jessica right here. Jessica is a mother of 2 who's had back pain for 10 years since she had her first child. And for her, it's affecting her when she's carrying these heavy objects, and after, at the end of the day, sometimes she just feels like she's taken out and just needs to rest and let the pain pass. But Jessica, tell us a little bit more on the pain that you've been experiencing for the last decade and why you're here today.
So my lower back pain started after I had my daughter and has progressively gotten worse. It is mainly in my lower back. And yeah, like you said, at the end of the day, I just feel like I have to lay down to relieve pressure.
Yeah. And how has this pain been affecting you since you've had it?
Again, it's gotten progressively worse, but now that, at the end of the day, sometimes I have to go to bed early. I feel bad because my kids are like, Mom, it's still early. But I'm just like so done that I'm just like, sorry, but today's gonna be an early night.
Yeah, sounds like you got some really active kids. They're playing flag football and doing a bunch of cool things.
Yeah.
So I can imagine how that can get, can wear on you a little bit when you want to be out and playing with them and your low back's not letting you.
Yeah, and they have practice like 4 out of the 5 days during the week. So
Wow.
we have late days sometimes where there's times I want to lay down, but I can't.
Yeah, that's tough, really tough. And if I can wave a magic wand and just make this pain go away, what would be different for you? What would you like to do differently?
I'd definitely be more active with them.
Yeah.
I think that I'd be able to run around with them instead of just being on the sideline.
100%. Yeah, maybe put on strap up the flags and get into. So we're gonna do some checks first. I want to get you better. I want you to get you to playing with your kids again. I want to see where you're at first, and then we're going to adjust and kind of chip away at things, and then we'll retest and make sure that we got the result that we're looking for.
Okay.
But today's her birthday, so I want to make sure that we give her the best adjustments so she can get out and play with the kids. Her daughter's playing later today, so I want to make sure she's good to go to celebrate and play some flag football.
Thank you.
Of course. Are you ready?
Yeah.
So while I got you here, we're going to check your neck, okay? So I'm going to have you lift up in posture. Look to your left as far as you can comfortably go. Some stiffness in the neck, so come back to center. Let's see this right side. A little bit better on the right. So we want that nose to be coming out to that shoulder. So on both sides, she's falling short just a little bit. Just got a reversal of curvature, so those joints aren't lining up. Neck muscles a little bit more stiff. So we're gonna start working on that as well, okay? So do me a favor here. Try not to bend the knees too much. Go ahead and bend forward, reach to the toes, as far as you can comfortably go. Okay, any discomfort there?
No.
All right, go ahead and come back up. So do me a favor here, keeping the knees straight, lift your whole left leg up as high as you can comfortably go. Okay, you can kind of get up there. It looks a little stiff towards the end right there, yeah? Any discomfort there?
A little bit.
A little bit? Go ahead and relax. Where do you feel the discomfort when you lift up?
Behind my leg.
In the hamstring?
Yeah.
Okay. Let's see the right side. Lift up as high as you can. Very tight on that right side.
Yeah.
Okay, so the right side for you is the problem side. Go ahead and relax there. Any discomfort on that right side?
The hamstring as well.
Hamstring as well. So this is going to sound kind of funny, but this is something called glute amnesia, okay? I know it sounds fake, right? Yeah. So your hamstring, your glute, and your low back have to fire in a specific sequence, and everyone needs to be doing their job in order for you to be able to do that comfortably. Your glutes aren't firing properly because of hip misalignments and the low back misalignments. So your low back and your hamstring muscles are having to work extra hard. So for you, when you're carrying heavy objects, what you're feeling later on is your low back screaming because they have to try to make up for the glute, which is the most powerful muscle in the body. Right now, you're feeling that hamstring tension when you lift up, because again, that one's also compensating too. So low back, hamstring working harder than they need to. We need to smooth out that tension and get things to activate and get you feeling better again.
Okay.
Okay? So I'm not going to be stretching your muscles. I'm not going to be doing anything like that. What I'm doing is with these adjustments, I'm stimulating the nervous system to get your brain more aware of that region so we can fire those circuits again and get things activating the way they should.
Okay.
Sound good?
Yes.
Cool. Go ahead and relax there. All right. So just like we saw in X-ray, left hip high, right hip low, you do have a little rotation too, okay? So this table's gonna lift up, it's kind of loud, okay?
Okay.
Going right here, I'm gonna find the right tension. And I'm gonna push on your hip over here on this left side, okay? Good. Recheck the height. Still a little bit of rotation, okay? It's interesting because your left side is the restricted side, but your right side is the inhibited side. So sometimes pain, or a lot of the times pain is not really the best indicator of where the problem's at.
Okay.
Let's bring it this way, a little bit more. After 10 years, it needed a few drops. Sacrum left, okay? So this is the bone in the center of the hip bones. I'm bringing this down and back, taking out the torque. Okay. L4. Do me a favor, take a breath in and hold your breath. Exhale. Breathe in, hold. Exhale. Good job. Okay, well, I've got you face down. I'm going to scan the thoracics, basically this upper back area to the mid back, and see what's happening, okay? You got a little rotation of the ribs too. I'm going to fix this first, okay? So you said when you drive, you kind of like lean one way, yeah?
Yeah, to my right.
To your right side.
Yeah.
So your right side was kind of sloped forward, your left side was kind of pulled back, right?
Yeah.
So our ligaments change depending on the positions you put them in. So if you sit chronically in one position, you can actually like make yourself chair-shaped or torqued and things like that. So right now we're kind of undoing all of that and trying to get your body to be like human-shaped.
Okay.
Sound good?
Yeah.
Good. Okay. Couple spots. This is a big one. And here it's more so like compression. I'm gonna hand you this teddy bear, okay? This is gonna go on the front right here, a little bit higher right there, and we're gonna cross here. I'm gonna go for the mid-back area first, okay? It might make a loud noise.
Okay.
Okay, you ready? I'm gonna roll you this way. And then we're gonna slowly roll back. We're gonna clear up right in here. Oh! Wow. Beautiful. How'd that feel?
That felt good.
That was a loud one.
Yeah. It felt like, I don't know, like I like if I like a fresh breath or something.
Yeah. Easy to breathe now, right?
Yeah.
That's awesome.
Oh wow.
Awesome. Okay, so I'm gonna bend this top knee right here. I'm gonna lift this up there. Can I borrow this hand? I'm gonna bring that down. This is gonna go right there and right there. All I need you to do is hold that elbow. I got everything else.
Okay.
You don't have to hold on for dear life there. I won't drop you, I promise, okay? I'm gonna bring you this way. We're gonna roll a lot, okay? I'm gonna push this hip back where it needs to be, okay? So there's the hip bone, and we're gonna drive it up this way.
Oh.
Wow. That was a good one.
That was a good one. It was loud. I felt that in my stomach.
Yeah. That was a big one.
Yeah. Wow. Yeah.
Feeling good? Yeah. Let's hit the other side. That was awesome.
Oh.
Okay, I'm gonna bring this up this way here, straight in here, and I'm gonna swap.
Oh.
And we're gonna bring this down. It's okay, it happens to everybody. I'm gonna turn you this way. Good, I'm right here, okay? L5 is the one that doesn't move on extra, right? We gotta bring this down this way.
Oh.
Bingo. Very nice.
Yeah.
Much better, right?
Yeah.
Come on up, have a seat right there. All right, I'm gonna stand on the table behind you to see what you got going on in the upper neck.
Okay.
Lift up the head for just a second. Good. So right away I feel that on that right side. Tender, huh?
Yeah, it hurts.
Left occiput too. Okay, so let's see here. Passively, it's easier for you to go this direction, so I'm gonna start there. Okay, so you're good there. I'm just gonna have you turn and then tilt like this. I'm gonna adjust the first bone in your neck on this right side, okay? You're gonna lean over this way. I'll walk you through it. And I'm hugging your head right now. This is different. But But this helps me kind of like bring this in and scoop it back into the joint. Just soften the shoulder. There we go. Wow.
Oh my God.
Yeah. That was excellent.
Oh, yeah, that
Good.
Oh,
How'd that feel?
yeah.
Yes.
That's so weird.
It's different, right?
Yeah.
Yeah. Kind of like how your neck's supposed to feel, right?
Oh my gosh.
Amazing. All right, I'm gonna stand on the table. We got the other side to take care of too, okay? Right behind you here. Good. I'm gonna turn you this way. I'm gonna tilt like this. Good, lean your head to the left side now. I'm just trying to find that joint angle. There's the joint, soften the shoulder. Wow, that was amazing.
Yeah.
Yes.
Feeling good?
Yeah.
Nice and loose, right?
Yeah.
She's testing it out.
No, you can really just feel like a difference right away.
Yeah.
It's like a relief or I don't know. It's weird.
Yeah. Like, this is what it's supposed to feel like without tension, huh? Yeah. All right, hang time. I'll do one more thing while I got you here. So we got a reversal of curvature. Neck's not going in the right direction. Typically these get tugged on, so I gotta fix that here, okay? I'm gonna use this right here. Might be a little tender. All right. Not too bad?
Not too bad.
Good. Good. A little more on the right. Good. So we're going to decompress your spine next, okay? Reversal of curvature, restrictions, lots of things have been going on with the body for the last 10 years, right? So I want to make sure to open up those disc spaces to give them a little bit more room, so when they come back, it's going to bring more water back into it, give it a little more fluidity, okay? You may feel this go all the way through the spine, but you're most likely going to feel a lot in your neck because of that reversal of curvature.
Okay.
Okay?
Okay.
All right, so do me a favor here. You're going to be lifting up the head for just a second. Good, I'm going to bring the hair through, keep the head up. Good, relax all the way back. So your hands are perfect right there. Just breathe through your nose, keeping your teeth in a light contact, okay? And you're going to feel a nice little stretch through the spine. So go ahead, keep breathing. Good job. Perfect. Nice and loose in the shoulders. Relaxing the knees too. You're doing great. Beautiful. Nice.
Wow. Yeah, you were right. I felt it in my upper back, like in my neck.
Upper back and neck?
Yeah.
Yeah. What did it feel like?
Like a big stretch.
Yeah.
Yeah.
Not too bad, right?
No.
It's a little intimidating at first.
No, but it's like crazy how right away you can feel like a relief.
Big time.
Yeah.
Yeah. That's awesome. Good job. And happy birthday. Let's have you bend both knees for just a sec. Good. Keep them up, keep them up. Go ahead and relax back. Good. Beautiful. All right, so we're gonna recheck your activation. It's gonna be like a magic trick, okay? Keep your knees straight, lift your left leg as high as you can go. Look at that. A lot better, huh?
Yeah.
How's the hamstring feel on this one?
I don't feel the pulling.
No pulling anymore,
No.
huh? Perfect. Let's see the right side. Beautiful. Good. Right side, it's great, but check this out. Lift up the left side and then the right side again. See how it's better the second time?
Yeah.
Let's see the right side again.
The right side, I feel like a little bit of pulling, but not as much as earlier.
Mm-hmm. So see how the second one was better this time?
Mm-hmm.
It had been inhibited for so long, those muscles kind of like forgot how to reactivate. So it took a couple reps to get that joint lubricated and get those muscles to fire in sequence again. That's where the exercises come in. When you're exercising after the fact, it's called neuromuscular re-education. So it's re-educating the body to that new alignment with the new motion. And it's gonna help those muscles fire the way they're designed to, okay? So try even one more rep. Let's see the left side again. Mm-hmm, and then let's see the right side. See how they're symmetrical now? That's perfect. How do you feel that time?
Better.
Better, right? Pretty sweet.
Yes.
Body's back to normal. So a little bit back to your right. Perfect. All right, let's check out the rotation. Look to your left as far as you can go. Whoa, look at that. That's a lot better. Let's see the right side. Right side, better, but still a little tight, right? So this is where we kind of chip away at that with that curve correction, yes. Right? But a lot better than before. Yes. Yep. Let's have you stand over here again. Go ahead and bend forward, reach for the toes. Wow, a little more flexibility there, huh?
Yeah.
Try reaching for the ceiling, and then bend forward again. Even better. Good. So your hamstrings do need some work too, huh? But they're doing pretty good.
Okay.
They've been working extra hard for that low back that's been kind of tight, or the glutes that weren't firing. So your hamstrings are a little bit stiffer because they've been overcompensated for a while. But over time, as those glutes get stronger and they start to fire properly again, that tension can start to dissipate.
Okay, awesome.
But you did great today. Happy birthday. Nice job.